Hello everyone. Thank you for joining us again for another town hall meeting, today originating from the Sullivan County Government Center in Monticello. On behalf of the Sullivan County Legislature, my name is Michael Brooks. I'm the Vice Chair of the Sullivan County Legislature. And today we have with us our Director of Public Health, Nancy McGraw. We have our County Manager, Josh Potosik, and our Chairman, Rob Doherty, extending an invitation to the CEO of Catskill Regional Medical Center, Jonathan Schiller. Thank you for joining us today, Jonathan. We're going to start right off with Nancy. First question, what are the latest figures, confirmed cases, people currently hospitalized, people currently recovered, people who have died, and how many tested?
Good afternoon. It is good to be back with you on this rainy Thursday. We do have 317 confirmed cases at this point, so we're continuing to see an average of about 20 additional cases per day. That's been pretty consistent over the last 5 or 6 days. So community transmission continues to occur, and we're getting those lab results back on a pretty steady basis. We're holding steady at 7 confirmed deaths, so that's not any additional cases from Monday when we last were on the town hall. We have 768 people in mandatory quarantine. Now people come onto quarantine and go off of quarantine for various reasons, so that is a cumulative number. Yesterday 105 people came off of quarantine, which is a good thing, which means that they were either in isolation or exposed and are no longer they're either no longer sick or symptomatic and
Whoop. Looks like we might have lost the connection.
We're going to try and get her back.
We might get her back.
Okay.
Oh, no, we have her back. Okay, we lost you for a moment, Nancy.
So 100.
Oh, okay. Losing her again. All right, yeah.
Okay, we will return when we have a stable connection with Nancy. So we're going to move on to our next question, which is for Josh. And it reads, in response to a question in a previous town hall regarding not issuing occupancy permits for camps and bungalow colonies, you replied that you could only urge visitors to stay away, but that your hands were tied by the state with respect to enforcement. According to Governor Cuomo's Secretary, Melissa DeRosa, the county can use Executive Order 202-11, Public Health Law 12 and 12B, and local building codes to enforce restrictions. She added that these laws carry civil and criminal penalties for noncompliance. Are we doing that?
Good afternoon. So recently in prior town halls that we've had, we've spoken to the issue of us not being able to issue our own executive orders to kind of control some of these issues referenced in the question. Subsequent to that, the state has provided us pretty detailed guidance on what code officials and local law enforcement can utilize under public health law and executive orders to kind of go after or enforce some of these issues that we're seeing. We've been working intimately with our local police departments, our district attorney, the sheriff's office, state police, and towns and villages through their code enforcement to kind of educate them and formulate a game plan on how we're going to address some of these complaints as they come through. So obviously, and pretty much we've seen great compliance for the most part when we've approached sites that have social distancing issues or other issues that are referenced in the executive order or public health law. So that's our first avenue, is to try to talk to the property owners or the people potentially violating some of these orders. But we are prepared to escalate that beyond just verbal interactions with them if there's continued non-compliance. What these orders generally still do not prevent or not allow is people moving to their second homes or bungalows or camps up in Sullivan County. So they don't prevent that. We have no authority to stop that at this time. We are working with our sister counties in the Mid-Hudson region to kind of formulate and try to see if we can get the state to kind of listen to us a little bit more about how we can address those locally. And all that said, with the camps, we don't really foresee, even if the camps issue permits, how they could operate with the social distancing requirements. So if camps do open, we'll be prepared to enforce the social distancing issue afforded us under the executive and public health laws.
Thank you, Josh. Nancy is back with us, so we will go over to Nancy, and you could continue your thoughts that you were sharing with us before we lost connection.
Can you hear me?
Yes.
Okay, good. Sorry about that. So I was, where I left off, I think I was saying that we had 105 people come off of quarantine. So that is good. That's a higher number than we've had in the past. So we've also had over 1,300 people tested, and several hundred are negative. We're continuing to call people back as quickly as we can with those results as well. No additional deaths. 768 people are managed for quarantine.
Thank you, Nancy. Next question is a long question and multi-layered. So we're going to have Nancy answer this question first, then Jonathan is going to follow up. Since antibody testing seems to be crucial in the steps for one type of COVID-19 treatment, and also will play an important role in getting folks back to work and life, and for the frontline workers, what is the county and the hospital doing to seeing that this testing is made available? Is the hospital adding additional personnel and arranging for these tests? Are we getting the faster COVID-19 tests? Are they easily accessible? Nancy?
So rapid testing will become available very, very soon. Increase the availability of testing. There will be issues with that, but can't go into that today. And Public Health and Catskill Regional Medical Center will be collaborating as well as with other healthcare partners to identify ways of possibly setting up an additional test site for the community. So we're continuing to work on that with state health department and it's dependent on testing supplies.
Thank you, Nancy. Jonathan, please answer that.
Thank you, Mayor. So at our hospital, we do perform the testing. We take the swab kits and we submit our samples over to the Wadsworth lab for New York State. It is a fantastic lab, one of the best in the country. Their turnaround time is very quick. We also do send specimens out to 2 other national laboratories who are also very excellent. Depending on the volume at the time, their turnaround time may be 2 to 3 or 4 days, which is why the rapid testing that Nancy was referencing is so critical for us to be able to bring into our community. And as soon as it is scalable and available to us, and we know that the quality is very high, we'll be able to bring that to the community in collaboration with our healthcare partners. With the specifics to the antibody testing, yes, we do this testing now in-house, and we're able to run specimens for a medically required prescription. The convalescent plasma program that's referenced, we are developing protocols for that. Not ready to go live yet, still have to gather some additional data, put our protocols together and develop the program, so that'll be coming in the future.
Thank you, Jonathan. And our next question is going to go back to Jonathan. How are we handling drug supply concerns? In particular, are we stocked with hydroxychloroquine and the Z-Paks for patients that need that treatment? Jonathan?
Thank you. So with regard to the drug supply initially, the hospital does have multiple sources in our supply chain for medications that we routinely utilize, and we've been able to utilize them throughout this pandemic as well. The drug supply is very steady for us. The only agent that we've had challenges with, although we do currently have supply, is paralytics that may be utilized for patients who are on ventilators. With respect to the hydroxychloroquine and the azithromycin protocol, the New York State Department of Health did issue a clinical trial guideline. Catskill Regional Medical Center did subscribe to that guideline. We pushed this trial through our institutional review board, which approved it, and we actively do have patients who are undergoing this treatment.
Thank you. Next one is also for Jonathan. Do we have an overflow area for patients available if there are not any ICU beds at the hospital?
Yes, so the answer to this question is multi-layered. The first is that this community should rest in great comfort knowing that our hospital and our county have fantastic emergency plans, and we've activated those plans at the hospital with relation to surge planning. The first thing that the hospital did to help create capacity within the organization is to reduce and eliminate any elective surgeries, procedures, and tests so that we can free up as many beds as possible for patients who may be afflicted with the COVID-19. Then, in addition to create additional capacity in the hospital, we activated our surge plan, which has created over 20 new ICU beds, as well as 30 new regular, what we traditionally would call medical surgical beds for patients who are ill but don't require ICU level care. On top of that, if we needed to, we have the ability to flex up to an additional 60 beds in collaboration with the hospital's own skilled nursing unit. We do have plans that we've worked with the county to develop if we need to surge beyond that. However, at this point, we're well within our capacity. Right now, we're utilizing about 40% of the ICU capacity that we have.
Okay, thank you. Our next question will go to Nancy. It's a long question. Please bear with me. I was recently in a local supermarket, and although they were limiting the number of people in the store at one time, I don't recall any staff wearing masks. And this was after the CDC recommendation. I've since read that some markets are not allowing their employees to wear masks. Are you aware of any concerns about this? And have management been educated that the CDC guidelines are to protect against asymptomatic spread, protecting both staff and customers?
Well, turn your mute off.
Thank you. We're continuing to work directly with essential businesses, including grocery stores and other areas where there are essential services, to educate them about the recommendations and the new mask guidelines. The mask guidelines are for the general public, but we also recommend them for essential workers who perhaps, like stores, are at in situations where there's larger numbers of people.
Oh, it looks like another technical glitch here. Sorry for that.
Nope, she's back.
Can you hear me now?
We can.
Okay, we pushed our information out to various channels, including the Visitors Association and Chamber, and directly through phone calls and outreach, and we'll continue to do that.
Okay, thank you, Nancy. Next question is for Josh. How are we responding to a potential influx of visitors this holiday weekend and in the weeks to come?
Working with our communities, just getting a general sense in some of our religious communities, we fully feel that the vast majority of people that were coming up for Passover and Easter are probably already here. So we don't anticipate a large influx of residents or second visitors to the county from what you're seeing today. Obviously, that could change after the holiday weekend with schools being closed across the state. So we're whether it's the holiday weekend or not, are continually monitoring social gatherings, and we'll use those social distancing, whether it's this holiday weekend or into the future as this pandemic continues.
Thank you. Next question goes right back to Josh. What are we doing to handle complaints forwarded to us by New York State on Pause's enforcement team?
You may have seen some coverage of what Orange County is doing with the Pause enforcement team. So what's happening today, and it's been happening for a few days, is New York State has a team of various agencies that are receiving complaints, vetting them for completeness and accuracy. If they feel that it's a credible complaint, they're forwarding them off to our EOC. We have several people that are getting them in email. We take a look at them to see if they are actionable, and if they are forwarded off to local law enforcement, PDs. If it's in a village or a town that has a local police department, we're forwarding to that jurisdiction. If it's outside of a jurisdiction with a local police department, it's going to the state police or sheriff's office. Some are code issues too that may go to law enforcement as well as town officials for code enforcement. We've gotten under 10 complaints thus far, anything from some people congregating for basketball games, then it seems the big question is what type of construction is allowed under this the new executive order, which has just changed as of last night. So there's new guidance on the ESD website about what types of construction is allowed. So I would refer you to that if you have questions. And again, if someone, so those complaints can take a day to turn around from the state back down to the EOC to a local PD. If you are seeing a member of the public or you feel there's a social gathering, you still have the avenue of calling the local police department, sheriff's department, state police to voice your concern if you feel it's an imminent threat. So we're on top of that.
Thank you, Josh. Last question I'm going to address, and it reads, I can't visit many local parks anymore. How can I get out and safely enjoy the outdoors with my family? The county parks and most of the larger town parks are closed. The whole purpose was maintaining social distancing. That's why it was done. And we have some smaller parks that are still open, and as long as those social distancing rules are followed, they will remain open. But there's hiking trails, walking trails. For those of you who are fortunate to have yards and large tracts of land, go out and enjoy. Like I said, it's just important just to remember that social distancing and all the things that you've heard about cleaning your hands still applies. I'm sure we've heard that there seems to be some hope because we've been doing a lot of the right things, that perhaps the worst, there may be some light at the end of the tunnel, but that is only true if we continue to maintain the social distancing, washing hands, etc. I want to thank everyone for joining us. We had a couple of technical glitches, but thank you for bearing with us. And so that about wraps it up for today. And I want to, again, express my thanks to Jonathan Schiller for providing us valuable information and your insights. And for a lot of us, this is a very special and spiritual time of the year. Keeping that in mind, I want to repeat what I said in a previous town hall meeting, that we as a people always do our best when we honor our own humanity by respecting that of our neighbors. In that spirit, we basically say, have a good afternoon, have a good weekend, and be safe. Bye for now.